Cancer can affect anyone. Being aware of potential cancer symptoms and attending screening appointments can save your life. Finding cancer at an early stage means it's much more likely to be treatable. This animation will show some simple checks you can do at home and explains what screening programs are available in the UK. Regularly check your skin and moles for any changes. This can help detect skin cancer at an early stage. Always get a mole checked out if it changes shape, gets bigger, changes colour or becomes darker, starts itching, crusting, flaking or bleeding. If you notice any new lumps on your skin or sore, scaly patches, it's always best to get it checked out. If you have testicles, you should regularly check them for any lumps or changes. Testicular cancer is easy to treat if you find it early. Check your testicles when you're warm and standing up, maybe after having a shower or bath. Roll each testicle between your thumb and finger and check for any lumps, changes in size or any swelling. Always contact a GP if you find anything unusual or have pain in either testicle. Checking your breasts regularly helps you know what's normal for you. Look at each breast and nipple to check for any changes in size or shape. This includes whether your nipple has sunken or become inverted, or if there's any fluid coming from one or both nipples. Check your skin for any redness, rashes, dimpling or puckering. Feel for any lumps or painful areas. Use the flat part of your fingers to gently work around each breast, pressing in small circular motions. Always see a GP if you notice any unusual changes to your breasts. Screening aims to find breast cancers early, when they have the best chance of being cured. Anyone between the ages of 50 and 71, registered with a GP as female, will be invited for breast screening every 3 years. You'll get a letter in the post inviting you. Breast screening uses a test called mammography. This involves taking X-rays of your breasts. All people with a cervix, aged 25 to 64, will be invited for a cervical screening appointment every 3 years. Cervical screening is commonly called a smear test and checks the health of your cervix. Your cervix is the opening to your womb from your vagina. During your screening appointment, a small sample of cells will be taken from your cervix. This sample is checked for certain types of human papillomavirus, which can cause changes to the cells of your cervix. If these cells are found, they can be treated before they get a chance to turn into cervical cancer. Bowel screening aims to find cancer early or to find changes in your bowel that could lead to cancer. UK screening programmes send a bowel cancer testing kit every 2 years to eligible people aged between 50 and 74. The kit comes in the post and is easy to do in the comfort of your own home. In the kit, you'll find a small stick, which is used to collect a sample of your poo. It will come with full instructions, guiding you step by step on how to collect and return your sample correctly. There are certain symptoms to be aware of that can indicate bowel cancer, so always see your GP if you have any of the following: bleeding from your bottom or blood in your poo, changes in your bowel habits, persistent pain or bloating in your tummy, fatigue or weight loss for no apparent reason. A PSA test is a blood test that measures the amount of prostate-specific antigen in your blood. A raised PSA level may suggest you have a problem with your prostate, but not necessarily cancer. This is why it's not offered as part of a national screening programme, but you can request one. You may also be offered a PSA test as part of a general health check. There are advantages and disadvantages of having a PSA test. and it's a good idea to learn more about these before deciding to have it. There are certain symptoms to be aware of that can indicate prostate cancer. Always see a GP if you have any of the following: problems passing urine, such as needing to go urgently or often, or being unable to go at all, blood in your urine, pain when you wee, a urine infection. Cancer is usually much easier to treat if it's caught early, so get to know your body and what's normal for you. Attend any screening appointments you're invited to, and always see a GP if you notice any lumps, bumps, or other unusual changes.